So very warm good morning to everyone. So today at Health Jaankari, this is our 14th session. So Health Jaankari is a community-driven platform to facilitate discussions around health. This includes preventive tips, knowledge sharing around city-wise doctors and hospitals, expert-led session by doctors to dispel myths and doubts around health, etc. We have been doing it from past, few months, and we are looking to bridge the information asymmetry to decrimatize healthcare for all. And every Sunday, we have special doctors who take up questions, who break these myths. And so today we have Dr. Neeraja. She's a consultant pediatrician and neonatologist at Indigo Women's Health Center, and she's a director of Nedo Health. Her list of achievements is endless. She has a 21 years of experience. She's a postgraduate from United Kingdom. Moreover, she obtained her membership from Royal College of Pediatrics and Child Health. She came back to India with a vision of transforming child health, and Nedo Health Child Health is a true example of it. By reading about her, one thing I felt was that all her achievements is a true epitome of knowledge, experience, and compassion. So thank you, ma'am, for joining us today. And we all, since week, I'm looking forward for this session. And hopefully our audience will find it fruitful as well. Thank you, ma'am.
Thanks a lot, Disha. It's my pleasure to join your meeting. And I think it's a great thing to give awareness to parents. And I hope, they get some information out of it. Thank you.
Yes, sir. So this session is majorly focused. I want to tell all my viewers that this session is majorly focused on telling about COVID and how it affects children and what are the measures that we should take. So we will be starting with journal COVID information. Should we start, ma'am? Should we start, doctor?
Okay.
Doctor, can you hear me?
Yeah. You just can you repeat it? Sorry, I couldn't hear you.
Yeah. So we will be starting up with journal COVID information.
Yeah.
Should I?
Sure, you can start off now.
So yeah. So how are COVID symptoms different from journal flu and other viral infections? Starting with something very basic.
Yeah, I think first of all, we all have to understand, the new COVID virus that we're coming across, and it's become very sensational now, is caused by the COVID-19 virus, which was founded in 2019. Yeah. And the general flu is caused by influenza viruses. And we have a lot of other viral infections. But the thing that we have to understand is the symptoms are very, very similar. And it's very difficult to differentiate between both flu and COVID-19 infection. So if you see children, because today's talk, we're focusing more on pediatrics and pediatric age group. So children usually present with cold, cough, that is the general symptom initially will come, and also fever and body aches. These are the simple ones that we come across in both infections actually. But the big difference is because COVID-19 is a super spreader. So it's very contagious and it spreads very quickly. And from one person to another person, unlike flu, it can spread very, very quickly. That's where the part is so the number of people getting infected, it's more. So this is a major difference. In terms of symptoms, unless we test, it is very difficult to differentiate. So I wouldn't say, okay, this is a simple cold, it's not COVID. It is very difficult. But then a good part of it is the symptoms are very, very mild in children. So far, we've seen majority of the kids, they've got mild symptoms, even with COVID. So that's the good news for all of us. Yeah.
Okay. So, like, as you said that, in children, symptoms are mild. So, should we, like, children have a tendency to have common cold or, with change of season, weather or something, even food. So, like, parents should ignore these journal symptoms, or they actually should look for the doctor, even if they have a mild cold or a cough or something like that.
So I think in terms of parents, they're very good judges actually, and they can really make all the symptoms, and they know their child well more than me sometimes. Like when they tell doctor, my child is very sick, and I take the parents' note very seriously because they'll be able to figure out. When they tell no, my child is very active, then I'll take it like. So first thing we have to remember, because they are common symptoms of cold and cough. So what I tell them, fever. What I tell parents is like, if your child is
Yeah.
having like with those symptoms and the temperatures come down with crocin or paracetamol, then you can wait for a couple of days. There's no emergency. But as such, like if you have difficulties, if the patient is not if the child is not hydrated well, is not looking well for the mother, like she'll be a better person to make out and tell to doctors. So in every other case, like not only with COVID, we usually tell parents with other infections as well. Like if you don't feel right, please do consult and get evaluated by your pediatrician. So anything that is, especially if the fever lasts more than 3 days, then it is like a warning bell. Please seek help immediately.
Okay, so like, what are the red flags for like seeking immediate medical help?
So the red flags are a lot actually, but then we'll just tell the common things that parents can look out for. Usually I'll tell parents like, no, if the fever is not like no settling down in 3 days, the child is vomiting continuously, not hydrated, not passing urine well, if the child is very drowsy, and and the other things are like if the child is having a lot of diarrhea and not keeping down the fluids, these are the signs that you have to think, okay, let's
Okay.
visit the hospital. Because at the moment, the main worry is about coming to the hospitals, and parents do wait in the house thinking everything will settle down. But at least I think these are the signs that we look for. If the
Yeah,
child,
yeah.
the other big thing, in terms of COVID is if the child is breathless and coughing continuously, this is the biggest red flag as well. And we tell please come to the hospital and then get checked by one of us.
Okay, so like, if a child is having mild symptoms like cold and cough, and should parents go for RT-PCR or something, testing, or when is the right time to actually go for COVID test, especially in case of children?
If you see in children, what we've seen so far is they are not most of the children are not the primary source of infection. So they're not the primary source. So they usually come into contact with one of the adults and then they
Okay.
carry the infection. So majority what we've seen in the second wave is the whole family unit as such had become positive. So we can see all the family members were becoming positive and the children also had fever. So it is quite evident then, and testing immediate after 24 to 48 hours in that case is quite easy. But in in a few in a lot of cases where parents are really good, there's no symptoms, no history of travel, and the child has got mild fever, mild cold and cough, we can still wait for a couple of days, see how the child goes, and then if it is not settling down, please still do an RT-PCR and then take it forward from there. But I think in quite evident cases where the whole family is positive, I do suggest please do a RT-PCR. And that's also not it is good for parents as well, because
For
they know what is happening and what they have to look in their child.
Okay. So, like, now coming to the next subtopic, that is COVID third wave. And there are all around, this is all around in the news and newspapers everywhere, that third wave is even more worse. So what is third wave? How is this gonna affect children?
So this is quite interesting topic because every day, like, I hear from my
Yeah.
patients and parents the same question, like, is this going to be dangerous for my child? What's going to happen with third wave? This is one of the regular questions for the last 2 months I've been coming across. Like, unfortunately or fortunately, none of us know the answer actually. But the one thing that, we have to realize is that because
Exactly.
the
Yeah.
main worry is the pediatric group have not been vaccinated. So that is the main worry. Like, we just think if it spreads, is there a big chance, like, a big number of pediatric patients are going to be infected if we have a third wave. Okay. And majority of the time we are
Yeah.
expecting there is going to be a third wave. But then what you have to look at is like, what is the risk for children? So far children have been at lower risk, even though they have developed
Yeah.
symptoms. So far, luckily, like, and on the positive part of it, like, they've been very less serious illnesses among children. And globally, if you see, 13% of children have been positive so far. I'm telling globally throughout the world, it's only 13%. And the death rate, if you look at it, is only 0.3% for COVID children, COVID positive children. So in terms of that, like, you just get this feeling like, I think we will be expecting maybe a little more number of patients. So 20%, maybe 15 to 20% across the world, but that's still a low number when you take, because we have 8 crore children throughout the world. So still the numbers will be very, very less. But the
Yeah.
only problem is if it is a super spreader and if it is going to spread to 20% of children, then we're looking like about 3 lakh children, whether we'll have high admission rate. That, like, we don't know so far. And that's why we warn patients, like, please be careful. But I feel very positive about it so far. And I still think, like, children will be on the lesser part. And it still be like, the adults, because the children can be easily spreading to adults. They can carry and they can be asymptomatic and spread to adults very easily.
Okay.
And also to the patients who are very weak at home, they can spread very easily. So that's the reason, like, that's one of the biggest reasons we have to still be careful.
Is that children can be a source of, like, they can spread easily. That's why it's a cause of concern.
Yeah. So we still, the main thing, like, what we have to think is the cause of concern is some children can be asymptomatic totally. So we've had, like, that percentage in adult as well, who can be asymptomatic and they can still spread the infection. So what we are seeing across is the same kind of situation in pediatric patients as well. They can be asymptomatic and they can play around happily and spread the virus to the parents at home and to the elderly population at home. So this is kind of like, the way you have to keep the child at home. And that's the reason we were isolating or keeping the children at home, not attending schools.
Okay. So you advise that schools should be still like they should be still closed,
I think
like
the
especially for
topic
children.
actually, that's quite interesting question, because I think my son will be watching this program and he'll be listening and he'll be waiting for my answer for this. So I have a lot of parents asking this question whether I should.
Yeah.
We're expecting, at least in Tamil Nadu, we've got a set date of September 1st as like, the opening for school from 9th standard to 12th standard children. I don't think it's a bad idea because at the
Yeah.
moment,
Mostly schools
numbers,
are doing that.
yeah, the numbers, it is a sensible decision because at the moment the numbers have gone down. And I think it's the right time to do a trial as well and see how the children. But then I would really keep, like, the schools have to be really having very good precaution, taking very good precautionary measures to keep children in a adequate social distance and also having good hygiene habits at school as well. I think that will come to the school part because now the government has given enough instructions and realizations, and we've been getting phone messages everywhere, the video calls everywhere, and there's so much of messages on social media. Now it's the parents' turn and the school turn to implement them. So I think schools have had enough time to do, and we've had examples from abroad, like US and the UK have had a stepwise, like
Exactly.
opening of universities and schools, and they've done pretty well. So the only problem we have in India is we have very dense population, and as you know, our health and hygienic measures will be challenging definitely for schools. But I'm looking at the positive side, and at least the private
Exactly.
parents are spending so much money and schools are spending so much money. So at least private schools can invest and they can look into what measures can be taken to prevent and keep the children at social distancing at school as well. So there are a lot of things that we can do because I shouldn't say this, but I see a lot of parents going to the beaches now and to the resorts. So we are taking, because I'm not blaming them. I'm just taking we're all tired of this thing. It's been going more than a year and a half now, and we're all tired, and we want.
Yeah, exactly.
But probably we can take this measure as well, send in smaller, like open schools in smaller groups, and probably lesser time, and then take it step after the other. Then it should be all right.
Yeah. So like yeah, I have a younger brother, and uh, I remember at the time when there was a lockdown and schools were shut. For 2 months, I think he enjoyed, and yeah, he's having fun. But then children at home, they start questioning, and it creates a sort of this disturb their mental health. So I would like to come on this now, that what are the journal precautions, or what are the journal tips parents should follow so that children do not affect their mental health? Starting off with this, like what amount of information parents should provide to their child so that they try to understand instead of getting disturbed.
I think now the kids and parents alike, they've gotten used to information because it's widely available actually. But then looking at the current situation, because parents
Yeah.
have to be honest. Like I would say, honesty is more, it works well with with the older kids, like the adolescent group, and around about more than 9 years, they're able to, even 7 year
Yeah.
old nowadays, they're very intelligent actually. So what is happening with the current situation? They can just explain to them, the common thing, what is the virus? It is, it just infects very easily when you're in the closer groups. And that is the reason we are trying to avoid play with your friends. I think by now they've gotten used to this, but the main problem is taking that fact, it's going longer and longer. So I think that's where parents and this children are
Yeah.
finding, because it's extending now and they're getting very unsettled at home. But then we have to say it's not only for our protection, it is for the community as such. You're trying to contribute, and there's a lot of emotions attached along with this for children. So as long as we sit down and talk to them once in a while, we are taking care of our elderly as well and our friends. I see, and when we explain to this to the to children, they're quite easy about it. And nowadays, they just feel, oh, there's so much of information on social media. They just feel very happy to look after our neighbors as well, and
Yeah.
they take that social responsibility. So once parent as it becomes more socially responsible, children usually do follow parents, and they see. And once we set example, it is very easy for children to follow parents and friends and family, I think. So the main messages should come from all of us, adults, how we behave and do social distancing, wear the masks regularly, I think still we can advocate small plays in houses, we can ask a couple of friends to come and play in the house, probably. That should still work for all of us.
Yeah. So like with respect to babies, like toddlers specifically, so what is the effect of third wave on toddlers? Are the symptoms severe, or it's gonna get worse for them, or is it just with a case of spread that we have to be concerned?
I think it's earlier we could cover this topic. So the toddlers are not going to be anything different. Toddlers or even newborn babies. I don't think it's going to be quite different. it's the same situation as such, like, but the only thing is it's controlling toddlers is very difficult because once there is an adult or a neighbor who's positive, like, toddlers, controlling them because they are not going to wear masks so easily. They're not going to wash their hands very easily. So exposure will be high. And
Yeah.
because the virus is close, like, spreading so fast, like, it is going to be difficult for parents to control toddlers. And as you know, as such, like, they're at home, they're not able to go out at all. Like the tantrums at home have increased, and like, the behavioral patterns have all changed. So controlling them is going to be really difficult in terms of hygiene or precautionary measures, I think. But how much ever we can do, we can try and do. And taking them out unnecessarily and into bigger groups and to weddings or to parties, to birthday parties, I think that is going to really cause problems actually. And
It's
as parents, all of us have to decide, like, at what time you're going to take the child out. I think in early morning, like, I've always told most of the toddlers wake up early mornings. I still think, like, a couple of, like, minutes or 50 minutes of a walk out with a mask on should not, like, do anything to them. So I will just, now parents have got so much of information. It is like, right time to keep the toddlers inside and not take them into the crowded areas. That is most important thing, I think, at the moment.
Okay. So now coming to this next question is that breastfeeding in this time, especially a mother who is suffering from COVID or a child who is suffering from COVID and they're on breastfeeding. So what do you say about that?
So according to WHO and in the Indian Academy of Pediatrics, we still advocate to continue breastfeeding, especially if mom has got mild symptoms and like, or no symptoms, but she's COVID positive. We still tell mom to wash hands, wear a mask while handling the baby, and then continue the breastfeed because we don't have any good alternative for other than breastfeeding because breastfeeding, as you all know, has got a lot of immunoglobulins and it gives better protection for your babies from other infections as well. And even COVID-19, that is a good preventer because we have good immunity in the breast milk. So we should continue. But in moms who've got serious illness because of COVID-19, it is better to express breast milk and give it to baby. And mother can be isolated into another room. Or sometimes we've seen situations where mothers are admitted and they're not able to feed children as well. So in terms of that, if we can get express breast milk, that's well and good. If we don't get milk, then, like, we'll go for other formula that is recommended for that age group.
Okay.
But in terms of
so like for
sorry, the other thing we thought was
I
like,
couldn't hear you.
Yeah, sorry. The other thing that if mother is like, not positive and if the child is positive, but still, like, I think the best thing is because the child would have been positive at any time, like, after delivery. So it's still, like, we have to take the positive test as positive, and breastfeeding is still good if even only if the baby is positive. So you have to continue breastfeeding and just take the other precautionary measures. When you handle the baby, wash your hands immediately. Don't meddle with your nose and mouth. And then, like, wearing a mask while feeding. It's the same thing what we do if either one of them is positive.
Okay. What are the these days everywhere it's about immunity and uh, brands, everyone, parents are concerned about immunity. Even my parents are so much concerned about immunity since I'm in college. So what are the what is the journal diet a parent should make sure that kids can have and that will boost their immunity?
As such,
What are the some food items must include?
I think it's not only for COVID. As such, generally, like, all of us, like, I mean, like, all parents should advocate a good, like, healthy diet and a balanced diet for children. What I see in India, or like, commonly in India, is we concentrate more on the carbohydrate content. So we concentrate more on rice and chapati. So like, and we forget about the, like, the main minerals and other nutrients come from vegetables and fruits as well. So as pediatricians, we always advocate a 5 fruit a day.
Yeah.
And it works well for not only, like, for COVID, for other infections. That should become a routine part of a life. And through COVID, many parents have been coming and asking me, okay, well, how should I boost immunity? Yeah, that's good. Like, not only for now, like, this is probably giving us a good lesson through COVID, actually. So people have started drinking more of lemon juice, and they've been given.
Yeah, exactly.
And we know citrus fruits increases vitamin C. Previously, many of them used to say, Madam, can I just give coconut water? Can I give lemon juice? Don't you think it causes cold? But it's like, the other way around, and we say to parents, like, it's full of vitamin C and it's useful in cold. Yeah, don't just bother about fruits giving cold. It's the viruses that are causing cold. So you can advocate, like, good fruit intake and a lot of vegetables. So that's where all your micronutrients come from, which you've been studying in school. No? All the micronutrients and the vitamins come from there. So that's what we say. But definitely, like, in some population, like where we see there are other medical problems and the child is not eating well, or they have other medical problems, where giving everyday multivitamin is not a bad idea. And in some children, like, in this kind of situation, if the parents are asking, oh, I still need a multivitamin, there is no harm in giving any multivitamin. Like, we can always give a regular, like, drops like Zincovit or Zincovit syrup. Giving multivitamin, it's not going to harm them. So a bit of boost is always okay. But as such, like, having a good balanced diet is very good. So giving a lot of fruits and vegetables is the main criteria, and also dry fruits, which are iron-rich food. That is a good idea.
Okay. So coming to the hot topics currently, starting with first one is vaccine in children. I mean, I heard about a lot of news that since if children will get vaccinated, the spread can be controlled. Or is it a myth, or what are the facts about vaccination for children?
So vaccination, sorry, I couldn't hear you. Disha, can you just repeat that? Sorry.
Vaccination, yeah. Vaccination for children. A lot of myths are going around. So what is your suggestions, or what is your take on that?
Okay. So unfortunately, in vaccination in children is not yet been rolled out, especially we don't have it in Tamil Nadu as well. Like, we're just looking at probably by the end of September, maybe, or mid-September, we would like to get vaccines. But what we have to remember is, like, vaccination has been an in and out in our profession every day. Like, every day in our profession, we do in and out vaccinations for children. And the wonderful thing I've noticed is very less percentage came and asked me during the clinic, okay, madam, what vaccine are you giving and what problems it causes? But because COVID-19 has become so sensational in social media, now all of them are questioning about, like, vaccine. When swine flu vaccine came, no one questioned, what kind, what brand, how much ml you will give, what are the side effects, none of them questioned. And if boosters are given flu boosters, I advocate personally to pediatric patients, like, if they are affordable, definitely please do every year until at least they're 5 to 7 year old. You can do flu vaccines. And we didn't, during that time also, because of flu vaccines, we get fever and the common side effects, like, we'll see body pains. Actually, this is the response of the body response to the vaccine. So that means it's a good sign if patients are getting fever, if they have a bit of swelling, or if they have a body pain, it's a good sign. It is showing that the vaccine is working and patients are, like, developing immunity to it. So we are going to develop antibodies. But now when COVID has come and when they're saying, like, we found vaccines, then people are really worried, like, is it going to cause a big problem? Because I think one of the things that came across through the world is, like, the fear about vaccines and the different vaccines. especially we had to rush the vaccine production in a short time.
Yeah.
Like, all of us were worried. In fact, our health professionals at the start, we were worried. And we were personally like, should we take? I've seen many of my colleagues who were not willing initially. But then now I think it is time, majority of us, if you see, like, we were at the start, all the doctors have got. And we volunteered and all the health professionals and doctors got initially. And through my circle, I've seen like, so many thousands of people getting vaccines. They're all fine. So you have to take an example of how many people are getting problems and how many do you personally know who've called you up and told like, yeah, we've got problems. I would be, there are a couple of vaccines in India that have been approved and they'll be out soon. But if we have one, like, we should go ahead and give our children. And because that is the only way we can now prevent the large scale of, the super spread that is happening with COVID-19. So that is the only way we can prevent as long as we vaccinate everyone. So my end point is about vaccinations is please don't become paranoid and about which brand or which one. Yes, you should work out what is the percentage and how much what is the efficacy of the vaccine. But by now, by and large, now you have a proof that in the second wave, especially that people who have vaccinated with in the first round, where even though there are some people who had an infection with COVID even after vaccine, but they were only mildly. They came up only with mild symptoms.
Yeah.
So you see the majority of patients who became very, very sick are the people who did not get vaccinated. And sadly, even among health professionals, we've had incidents. Majority of them, if you look at the end of the day, it was doctors or other health professionals who had very serious illness, were who did not receive vaccines, or they had only first set of vaccine and they still were due for a second set of vaccine actually. So second dose of vaccine, I mean. So that is a good example to say that,
so
we should go ahead and get our children vaccinated as soon as the vaccines are available throughout India.
So what is the age group that should be vaccinated in children?
Okay, so far in abroad, we've seen the vaccinated majority of the patients from 12 to 18 years, the age group. And even in India, at the moment, we are going to, the government is setting up vaccinations and we've got approval for 2 different vaccines. And we are looking forward, to vaccinate about 12 to 18 initially. And less than that, I think it will come as a next step. So how we roll on this for the older ones, and then we'll go to the younger ones. But we don't have particular studies for the younger ones.
So parents generally have this question that is this vaccine gonna have a long-term effect? Obviously, right now, I think I don't think, but I mean, are they gonna have some long-term effects for COVID vaccine?
So that is that is a question even whether it is adults or pediatrics, it's the same question. We'd be worried when we are getting, is there a long-term effect? But we don't have any particular group of study because it's going to take a long time for the study to come out. And in kind of emergency situations like this, you have to weigh the pros and cons. So in you're trying to save a life and that is a very important thing. And if that has to happen, we have to take the vaccine. And I think so far, at least through the year, we've seen it's almost going to be a year. We've seen abroad, like I'm saying, adults or the pediatric populations been vaccines. It's going to be nearly a year, in a couple of months for pediatric patients as well. But they've been so far, they've been good. And even with other vaccines in our experiences, what we've given for pediatric patients, and not only COVID vaccines, the other vaccines, we've not had any majorly health impact because of the vaccines. We haven't seen any major side effects. I mean, that is transforming their lives or putting an end to their lives. We haven't come across situations that's. I'm hoping on the positive side, and I'm just thinking that that won't be the case even here as well. And to save all of us, this is the only measure that we have to accept and go ahead with the vaccines.
Yeah. Yeah, actually getting life back to the normal, I think that's the only solution we have. So like you talked about symptoms or like post effects. So what could be like, what are the different symptoms a child could have, and what are parents advised to do when they get those symptoms?
You mean after vaccination, post-vaccination?
Yeah, post vaccination. Yeah.
So post-vaccination, and now parents are if they have children, they're quite used to this actually. But then the common things are common. So what we see is frequently is fever. Fever is the main symptom, and usually we give paracetamol if the fever. We warn parents anyway. The next 2-3 days after vaccination is going to be different. So they might have fevers, they might have body pains. If it is babies, they're going to be unsettled. They're going to be irritable. So these are the common things that we see, and also the swelling and pain at the site of vaccination. This is the second thing that we very commonly come across. So major things are these, and also in adults they've always told about body pains. The older kids can always come to us and tell about body pains. But for all of these things, like the simple medicine like paracetamol is more than enough, and it should all settle down in 2-3 days time. Sometimes swelling on the vaccination site can take a bit longer, but usually a few ice compressions a day, and it will take a week or so. It will usually settle down. And we've seen
so now, yeah, go ahead. Go ahead, ma'am. You were saying something.
Any other major side effects, we haven't come across very frequently. But the other ones, it is more like when you read a lot of papers and Google information, there are a lot of scary things that you come across. But I would keep that as don't Google too much, and just ask the common things, and then parents need to be very cool and just look for the common things first and go ahead with vaccinations.
Yeah. I think that is the thing that I think parents should get convinced with this thing, that go with it, please.
Yeah.
What is, since it's spreading and hospitals are the most prone areas actually. So is it okay to skip your regular immunization programs during this time? Or one should go for it?
Yeah, we had a challenging situation regarding this because we had newborn babies and we have regular immunization that needs to be done, because it's not only about COVID we are worried about, because there are a lot of other infections and these infections as such can be a pandemic, and we've had and they become an epidemic as well. So it is very important, especially for newborns. We have advised to take the vaccinations on time with and with pediatricians taking adequate steps not to overrush the clinics, to give adequate time. I've done that myself actually. So I've given 15 to 20 minute booking time, and I've just spaced out the patients so that they don't enter. And I've advised them, you wait in the car or you wait outside, just keep distance and come one after the other. So we can still do immunization in that way. But what happened in May was we had a very big spike. The May was the worst part, May and June. And when the second wave had entered the peak, so there was difficulty because parents did not have any kind of transport. And they were worried, very, very worried, because they had so many incidents in their own families. They were worried, whether we should get immunizations done. So that time, I think the older ones, more than 1 year old, you can always, postpone the vaccinations. Don't skip them totally, but you can postpone during the peak of the infection. And then you can take after a couple of months. That is not a bad idea.
Infection.
But for the younger ones who are less than 1, like, who need like the primary vaccinations, we would still advocate, but then try and like, make sure that the place where you're going to is not overcrowded as well, because like, the hospitals as such have been busy. So at least if we can, like, make to places where it's not like, too overcrowded, you can get the vaccinations on time for the little ones. And the older ones as such, like, if you skip for a couple of months, it should be all right. Nothing to be worried about.
Okay, so like what are the precautions parents should take, like while visiting the hospital and uh,
So I think,
journal precautions they should.
yeah. So generally, like, any, so far what we've seen is like, the three important things, like, we have seen wearing your mask properly. And I've always advised parents, like, when they're coming, I see the masks all over the place. Like, I've seen them under the chin, going under the nose, because they're not used to. We medical professionals are like, generally very used to wearing masks, and we can keep them for a long time. And we can manage without touching as well. But touching, if it is even difficult, that's fine. But especially when they're coming to hospitals, I've always advised them, like, you double mask or at least wear an N95 and come to the hospital. And when you're sitting out, it is your responsibility that you sit, maintain distance from other patients. And especially, like, if patients are sneezing and all, just keep the child away. Uh, and then teaching your child regularly at home to wash hands is always like, soap and water is always like, the first priority compared to, like, even sanitizers. Sanitizers is second, like, after, if you don't get like soap and water, then you keep your sanitizer, a small one in your bag, and it's not a bad idea, like, to give it to your child after finishing
Yeah.
consultation and out from the hospital, or if they're touching anything. So it should be the one, like, that is the main thing. And the other thing also, not overcrowding in one place. I can see, like, even now after so many, when we have deliveries, I got like, so many patients, well educated people, and they're like 15 to 20 people outside waiting in the waiting area for one delivery, because
Exactly.
the excitement. But then in this kind of situation, you're putting yourself at risk and you're putting others at risk as well.
You
So
have.
making sensible decisions, like, yes, we can wait for the baby to come home, and then you can have visits, like, one day after the other, even at home, I'm saying, not only in a hospital. So they should take, because sometimes it's becoming difficult for the hospital staff to concentrate on work, because they're always reminding you have to wear mask, you have to put the sanitizer, please don't crowd in hospitals. But now I think it is our moral responsibility as a citizen, and, like, take it, like, we should not be doing this. And probably it's a lesson for the future as well, because it's not only COVID-19, probably we are going to have a lot of other weird and wonderful viruses in the future. So it is probably a starting lesson for all of us, that
Oh my God.
our practices and thinking have to change. Yeah. And wherever it is, like, we should be able to change our behaviors immediately. Probably this is the kind of lesson, and God has made us realize that, maybe.
Yeah. So now you actually said about that, uh, about journal hygiene tips. So what is the right way of washing your hands, and parents should guide them, if you can tell us about that.
So usually any, like, like antiseptic, like any soap, like Dettol, or even the regular soap. If you don't have any access, or, like, or regarding your finance, a regular soap also, just covering until at least half of the, like, just below the elbow, half of the hands, and then washing for 5 minutes, covering all fingers and all. That is good. Like, it is difficult definitely for children, because you just tell them, they'll put a liquid on their soap and they'll just hurry and do and go. But at least how much ever you can just try and tell them uh,
Yeah.
to wash properly, cover all the fingers in the back of the hands. And at least, like, if they can do it for a minute or two, that is quite good, actually.
Okay. So now the since I mean they people have pet at home and pets at home, and now I think the number has increased because of the COVID. So what are the precautions one should take with that respect? Especially, I mean, children's, because they get very attached to
I'm a pet
pets
lover.
and dogs and everyone.
I'm a pet lover myself. I
Yeah.
love pets.
Oh, that.
But it is quite like, I don't have pets at home though, but I would love to. But the thing is like, in this, like what we've noticed now, we've had good 1 year, all this is happening. So what we've understood through all this is like, pets haven't given or transferred infection to human. It's the other way around. Pets should be scared about us, like, whether we are going to transfer infection, even though they can't talk. Probably we should look the other way around, whether we give any infection to the pets. Now we had incidents like, we can we've had reports like, in a few zoos, like, the tigers had become positive. But still, I think the other way around, animal to human is still like, not like that high number. It's not like, I think we are the ones where it's perfectly fine and safe to have pets at home. As long as you, like, you keep them tidy and, like, wash them frequently. And I think it should not be a problem so far. So for that, I'm not.
Okay. So like a journal,
I've not advised parents, like, you just chuck your pets away, because they've been they've been actually, I haven't heard myself, like, this is caused by my pet actually. And the pets have been fine without any symptoms so far.
so like what is MISC? This is currently going everywhere. So can you
So
elaborate about that?
yeah, we thought like, so what is it like, one of the red flags that we were talking about in children, like, you were asking me when should children come into the hospital. So in the, what is MI,
Common. Yeah.
inflammatory systemic disorder in children actually. So what happens, the multi-systems are getting inflamed. So what we see is this happens in a later stage actually. What happens after 2 weeks or so. And also we want parents after 3 days, if the diarrhea is persisting, if the child is complaining of abdominal pain, or the child is having like, new rashes anywhere, or with the swollen lymph glands, like, we can see swellings in the glands, or there's a rash that is peeling off on the skin. So it's very similar presentation to what we call is what we've seen in pediatric group, Kawasaki's disease. So something very, very similar to that presentation. So what we want, and most of that comes as a delayed thing, because it is a reaction because of the delayed immune response actually. And this happens. So if the symptoms of like these kinds first, like, present, and you're worried, like, conjunctival redness, like, as I said, peeling of skin, lot of vomiting and diarrhea, and patient is dehydrated, and like, complaining of abdominal pains or headaches. So we've
Okay.
had a few children admitted in hospital, especially during the first wave. We had like around about 50 children in Chennai who were admitted in Child Trust, and they were treated. But the good thing is they've all responded well, even like, on admission and treatment. Right time, the parents have to come to the hospital without delay. The delayed presentations are the problems actually. So if they think something is going on, I know at this moment, like, the fear
Okay.
for majority of parents is whether I should go to the hospital. So that is a question. But then, like, you know your child well. If it is going for a long while, there is no reason to,
Yeah.
and there is no reason to do phone or online consultation, because if child is sick, child is sick. Child needs to be seen. Because many of the things we can't find out, and unfortunately, we can never find out on the phone. I can always ask questions, but what you see is different from what
Oh,
you.
yeah.
So clinical examination is very, very important, especially for
Yeah.
complications. Yeah. So I've had a lot of questions of why you're not doing online. I've told very simple things I will answer, that, like, some things that need to be seen have to be seen. So they have to come and show. And I think getting evaluated in the hospital, in a pediatric hospital, is important at that time. But
Yeah.
getting.
Even I was about to come there. Yeah. That, you know, uh, so like we talked it about in the starting of the session that, about there are some journal symptoms. So I think so can online consultations can be enough for that, or should we go to the hospital for that also? Like cold, we talked about journal symptoms.
The general symptoms,
Can
like,
online consultation,
yeah, the general symptoms, because like,
cough, cold?
during the peak, like, when parents were not able to come, or like, there were multiple members who were very sick, and we had
Yeah,
to deal, like, that's kind of situation where we did phone consultation, not only for patients, for friends and family, we still did, like, phone consultations or online consultation, because there were situations where parents couldn't even come because the whole family was positive, and there were few who were admitted, so
hmm.
traveling was difficult. And
Yeah,
in fact, in those kind of situations, what we saw was the children were the only ones who were mildly symptom. But managing them at home was difficult because all the others were sick. It was not because the child was very severely infected or had severe problems that was the issue. It was mainly because all the others were sick and they were tired actually looking after each other. That was the main thing. But as I said, when you hear about red flags or when you see that, I think we don't have a choice. Even they have to come. And if they're not able to travel, I think the best way is to get an ambulance from the hospital and just come with the child. And good thing is when more parents are positive and the child is positive, they need to be admitted. They can at least keep them in the same cubicle. It's not like, we have to isolate them. That's a good thing.
so that.
Yeah.
Okay, so like you said that, children get sick, if even we adults get sick of, so like if a child is suffering from COVID, what is the how to deal with their mental status? I mean, that's like a journal tip for parents who kids have COVID or something. So how to deal with at that point of a time?
Okay, mental health in children is a big topic as such on its own. But what we've seen is like, it's always underplayed because children can't talk, children can't tell things, what is happening to them. And if you see, we adults are always moaning and we like, we're chatting and talking with friends and saying, Array, we're not able to manage alone at home. We need like, meet someone or we need to go for a party. The children, are the quiet and suffering group, like, this
Yeah,
is almost like a traumatic event, like, even though we consider it's not affecting them, like, it is affected in a big way because they're not able to meet friends, they're not able to vocalize, they're not able to express in the own way they do. And like, even if I sit for an hour or so, I'll just tell, like, okay, can you please quieten? Even though my daughter is in college, if she has to talk something, I'll be like, can I just do my work? So it is going to be a challenging, and whom should they talk with? And how long they can be locked up. So it is going to be a traumatic, and this will all come up.
yeah,
By next year, and we'll see a different child actually, because they don't know, especially the younger age group. The older ones are into different gadgets now. So number one, it's about like not able to socialize with their similar age group. So their sharing and their communication skills are going to be affected profoundly. Okay. And number two, what I've seen is whether we're doing a bad thing or a good thing, we are doing distant education on online. And I can see myself what are the side effects that we are seeing. They're more than medicines at the moment. So children are getting like, quite addicted to even we adults, like, for the last few years, we've all been addicted to the social media, to the computers, to the phones. And keep
phone, yeah.
minutes away is going to be very, very difficult actually. But then sitting and talking, I've had some strict rules myself in the house, like, for how many hours I'm going to let them want to be online, or how many, like, how many things they can hold at a time, how much ever possible, like, because many parents are working as well. And even for moms who are at home looking after children, it's going to be challenging because they have other chores to do at home. So it's like not only looking after the child, and the children are very, very quick. They pick up the mobiles and like, they're playing games. It is only 2 minutes they can flick the phone and go to the other room. But I think how much ever we can, we have to protect them because it's their mental health in long run. It's going to be really bad in terms of getting addicted to the social media as well. And if the main thing is how much ever parents can, if they can get some time, advocates, like, some time to play with the kids. You can have some board games or some dedicated time to watch TV together, or like, create some small games that you can do in indoors. For the smaller ones, I mean, like, for the toddler age groups, if you can organize in the house or in the open, if you have a private house, like, you can do the open terrace. And I always tell, I still have this feeling like, we leave the early morning and we leave everything to the midday actually. So early morning when everyone is like, asleep and the roads are empty, the parks are empty, couple of like, 50 minutes or so, like with the mask, with the lighter mask, with the blue mask, getting them to run around should, like, it should really help in their development and happiness in this kind of a situation. Sorry.
Okay. Thank you. This was actually very informative. So thank you. Now, I mean, the list of the questions are endless, but we have to end it as we have time constraint. So thank you, Doctor, for joining us today. This session was amazing, informative, and still I feel like it's been 1 hour. I don't feel like it's a 1 hour. So thank you everyone for joining us. This was the 14th session on Health Jaankari. We have our social media pages where we try to spread more awareness and understand about health myths and practices. All these sessions and previous one have been uploaded on our YouTube channel. You can go and check it out and clear your doubts, myths. Make sure you support us and connect with us every Sunday in Health Jaankari newsroom sessions. Thank you, everyone.
Disha, I think there were a few questions posted in the group actually. So I can, I'm not able to retrieve them, but do you think you can get few of them? Because I don't want the audience to leave disappointed actually.
Yes, ma'am. I'll take it. My video is not working, but I'll take it by audio only. So we got 2-3 questions. First question was about corona status, Delta variant status among children in Tamil Nadu.
Sorry.
So do you have any updates about that? What is the current status about Delta variants in children in Tamil Nadu?
Previously, Delta variant is the last one we had actually. And as I said before, we had only, like majority of them had been only mild cases that we came across. And pediatric age groups did not have major serious illnesses actually. So as I said previously, they were only like, a very small percentage, very, very small, negligible percentage that went into serious illness or like, having a, like, untoward incidents. So I like, I wouldn't worry, but we don't know what other new viruses, because this virus is like, quite complicated and very tricky one. And I think it's very naughty one as well, because it's replicating and mutating so fast. It's like, we have to wait and see what other different variants we're going to face actually. But at least now, majority of us are mentally prepared and waiting for the third wave. That's a good one, because second wave, no one was even trying to understand, like, that there is going to be a second wave, in spite of so many medical warnings, like, from different professionals in the medical field, that there is definitely going to be a second wave. No one is in that time. At least for third wave, they're asking me, oh, when is it going to be? They're mentally like prepared or so. It might not be very soon now, but like, our behaviors will decide that actually. So I can still see in public, like, a lot of them behaving as if nothing has happened and the world is free of everything. So I think that is the main stay actually. If we practice good social distancing, not getting into crowding places, we are going to have a hold, or probably we're going to delay the presentation and spread out, like, what you saw in second wave is all the patients crowded in 1 month actually. But at least even if we have third wave, if people like, behave themselves, then we can at least spread out, and so that the hospitals are not overcrowded and we're not able to treat them at the same time. So that's where people have to understand, like, when we say, please don't do this, because it's not about, like, getting medical treatment immediately. It is about, like, how we can give medical treatment to a vast population if they're getting admitted at the same time. So that is going to be very, very challenging actually, if it happens, especially in pediatric group. So that is because we are not you saw in adults that, we were not well prepared, and we did not have the health facilities, because we have the district levels and village, we are not well medically equipped to look after sick patients actually. And it's even
out of resources.
we don't have enough resources. And especially if we take pediatric patients, you have to see in each city how many of hospitals are well equipped and have a big PICUs. It is very, very less. So that's where, the warnings are going more to mothers, or to parents actually, that we have to be careful with children, because if that is the case, because the next vulnerable people are are the children, because we haven't vaccinated them yet. So we don't want abnormal numbers to get into hospital. But saying so, the good part so far is as I said, it's like a very small percentage that was infected and had severe illnesses. So that is a positive part, that children are getting away with milder symptoms and they're doing well.
Ma'am, one of age groups of children, like for teens and adults, there is different kind of insecurities developing due to pandemic. And for infants, or 10 years or 12 years old kids who are, you used to go to school 2 years back, but now they don't have, they're not able to understand it. And maybe, okay, young adults like 17 or 16, or adolescents, they are able to understand the situation, but they're not able to deal with it. So what is your advice from a mental health perspective for all different kind of, age group of children, so that parents can, easily talk to them, they can understand, and all those insecurities about the pandemic and about their future can be, subsided by having certain conversations?
I think and not only through COVID, COVID has made us realize that, because the younger ones, the toddler age groups, are the younger than that, they're not able to go out and sitting at home. So we have seen patients with speech delays because they're only at home with the moms and they don't get to interact with other people. They're not going to the play groups and all. But probably it's the right time as well, for parents to realize that it's not only the school part, just sending them to school and they're going to learn. We need to spend some time with children. We need to, allocate in your diary. I always keep a diary. You just write down how much time, what time are you going to give to your child as well. It works out well if you plan the earlier day, and you give categorically. You have to do that actually, not only through COVID. Generally, also I see parents spending less and less time with children because they are more on the phones, or they love their computers. But I think this COVID has made realize, because it's been popping up questions because they're not sending them to school. But then leave alone COVID, how much time as parent are we spending time with our children for their development? So always conversing with the younger ones, and you have to become a child when you're with a child. And that's what gets them. And you have to show positivity to children. That's how the development is going to be good. So if you want your child to be a happy person, you have to show happy things. Whether you're happy or not, whether you're you're busy at work, but you're still going to have to do things for your child. So please create a small play area or playtime for kids, and do different things for the toddlers especially. Do puzzles, do the bigger blocks, do building blocks, and organize small games. Nowadays you get everything on the media. Funnily it has become a problem for us, but you can get a few things. What and all you can do, small things. For the bigger kids, you can do activities like making cards or drawing sessions, and sitting them and doing paintings, or you give them activities for writing, and then have some time for storytelling, or making them understand books. How many kids have you seen nowadays with books? I was a good reader. I was with a lot of books. I haven't seen kids now who are taking books. Then I'm I can see my son who's older now, but he's 12, but I can directly see him going to Kindle and having, they don't have a collection of books. now is the right time, like, you're going back almost with cooking and even reading, we are going back actually. And it's a good thing for us, like, go back and, get your child to read books and take them to places like, that are not overcrowded. Even now, you can take to different cultural areas. Like, we hardly visit, like, which areas of interest, like, where we can advocate our Indian culture. We hardly take them actually. You take them for dinners, we take them for outings, but like, to the beaches or parties, but we hardly go and like, do trekking with the kids, or we can do like, go to the sea where it's quite isolated, and then take to temples or like, other like, dams or something. We don't do that. Very, very less percentage do that. There are a lot of the things like the malls and play areas actually that we can do with children. So I would advise parents to spend as much time during this time if we don't have schools now. And the other thing is like, avoiding screen time, having less screen time. You have to have a dedicated screen time. And if you don't have rules for that, it's going to be difficult for the child, because as you know, we've seen kids who haven't been able to take exams with screen addiction. So I've talked to a couple of institution heads, and they've informed me like, there were one institution said like they have a couple of children who did not take the 10th board exam because they were addicted to the screen. They were addicted to the video games, and the kid was overnight on the video game and couldn't get up and attend exam in the morning. So that is a warning bell actually. And all of us, like, even adults and like, children, we should have some dedicated time to be on the screen. And this will help, like, so make fun for children, like, make their living fun. Don't make it too serious and like, just leave them alone.
Okay. Thank you so much, doctor. This session was so amazing, so interactive, so informative for all kind of children, like for all categories of children, and as well as for parents also. It was so helpful to understand how to deal with their children in this pandemic. And even similar sessions we bring every Sunday on new Health Jaankari news sessions, where we bring different doctors of different speciality who have worked in this field for years and years, and they have tons of experience. And today Dr. Neeraja was here for us to tell us how we can battle COVID and children, and in this upcoming third wave we can prepare ourselves. And every weekend we bring these amazing sessions. It's everywhere on our social media. The links have been provided in the chat box. I request everyone to share with their friends, share with someone who it might help. And we have over 300 video collection of similar questions, myths, and health information answered and verified by an expert. And they have come here to tell us how much wrong perception we have as an unaware audience, as an unaware public. So thank you so much for everyone for joining in, and be safe. Have a happy Sunday, and let's connect again. Yes, ma'am, please go ahead.
Sorry, one more thing. I just saw one question. I think it was for those who is asking question, like, that whether we should test for antibodies before giving vaccination for children when it is available. Actually, so what are antibodies testing actually? So what is antibody testing? We can test our blood after infection, whether we've developed antibodies, but then the natural immunity only lasts about 3 to 6 months. That's why we, like, when we told patients, like, there've been many incidents when patients have got, like, adults, I mean, who had vaccines at the first time, and the second dose they were due, but then they developed infection. So, and there was a query when to take a vaccine actually. So now we know that, the natural immunity as such for like, the antibodies lasting time is only 3 to 6 months. So we usually advise, like, adults as well to take antibodies, like, to take the vaccines at least 3 months after your initial infection actually. The same thing is advised, like, for pediatric age group also. You need not test for antibodies, like, before giving vaccinations, irrespective of, like, the infection after 3 months of having the primary infection. You have to, when the vaccines are available, better to get the child vaccinated. So that's the only, sorry, the last one I had seen actually.
Definitely, ma'am. We have so many questions, so many queries. We need again. Till then, we are gonna, go because we are out of time today. But we had to extend because there were so many questions that needed to be answered, needed to be addressed. But till then, till next time, thank you all for joining. Thank you so much, doctor, for joining us and helping us with clearing so many facts, so many myths, and making us more aware about this COVID and children agenda. Thank you so much. Thank you, our audience, for joining in. Have a happy Sunday. Be safe. Stay at home. Thank you, everyone.
Thank you so much for this opportunity to Tejasvi as well. Hardik and Disha, thanks a lot for hosting this session.
Thank you, ma'am. Thank you so much.